You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
You are listening to the Locked On Pharmacy Podcast, the insider's view into the world of pharmacy.
Hey, welcome to the APHA's podcast. This is Locked On Pharmacy. I'm excited. I tell you what, I am charged up. My name is Todd Urey, founder of the Pharmacy Podcast Network, and it's an honor to be here with you today. Supporting the APhA for their publications has been an absolute honor for the Pharmacy Podcast Network. We cannot wait to see you at the APhA 2025 event. I think it's coming up end of March, sometime in April. We'll have more details out on social media on that. We do have a special episode. We're very concerned, obviously, with the continuation of redefining how pharmacists and why pharmacists are being paid for specific actions, clinical interaction, intervention, and treatment management. And it's so excited to have the team here today. I want to introduce the executive director of the Oregon State Pharmacy Association, Brian Mayo. Brian, thank you so much for joining us today.
Thanks for having me here, Todd. Really appreciate the opportunity.
Absolutely. Representative Rob Nousse, rhymes with dose, by the way.
Yeah, you said it just right.
And you're with the District 42 of the Oregon State Legislature. This is an honor to have you here today on.
Thank you very much.
Thank you. And Dr. Michael Murphy, Senior Advisor for the State Government Affairs of the American Pharmacists Association. Michael, I can't wait to see you at the booth again. You're always in the government affairs section, and I'm over in the podcast media section. I can't wait to see you at APhA 2025.
Absolutely, Todd. Looking forward to seeing you and looking forward to the great discussion here today.
Absolutely. I want to start off with Rob. Give us some background. As I said in pre-recording, I am fascinated by the work, and I'm 52 years old, and you know how you have your life planned out in the way that you think it's going to go. I want to make enough money from a personal perspective for my retirement through this publication. When I hit the magic number of 60, I want to pull the lever and go for a state representative. And then
right on.
I believe in what you do. So I'm so honored to have you here and understanding in the grassroots level what's happening in your neck of the woods, what's happening to your constituents and your people and your patients, and how PBMs are impacting patient care, and that's real, and that's a little bit scary sometimes. But open it up with some background on yourself.
Sure.
and why you serve.
So for your listeners, Oregon has been on a journey to sort of regulate the business practices of pharmacy benefit managers, PBMs, for almost a decade now, actually a little over a decade. And honestly, what happened is sort of accidental. So it's kind of a legacy policy area for the representative of House District 42. The guy that preceded me by one term went to fill a prescription for his wife. His wife is a physician. I don't remember what the drug was they needed. And for your listeners, I represent inner Southeast Portland. This is a super urban area part of Portland. It's just across the river from downtown, okay? And he went to I believe a Walgreens. And this was 2013. And Walgreens refused to fill his prescription. I don't remember who his insurance carrier was. And they said, we're having a dispute with our PBM and we can't afford to fill this prescription. Okay. And I'm sure all your listeners know Walgreens is a big corporation.
Yep.
Okay. They're not a small mom and pop, retail local pharmacy. So my guy, the guy that preceded me, he didn't know what a PBM was. And this is back in 2013. And I think most folks didn't know what a PBM was. For your listeners, before I got into politics in the Oregon legislature, I worked for a nurses association as a union rep and bargainer, did a lot of work around health insurance. Even bargaining health insurance in a healthcare setting is difficult and tedious. And I had never heard of a PBM, and we definitely bargained over drug costs periodically and what nurses would have to pay. So when I got to the legislature in 2015, I was sort of given the torch by the Pharmacy Association and by the former representative to sort of carry on the PBM legacy. And I'm happy to talk at a later point in the podcast about what we've been trying to do around PBMs in the state of Oregon.
Thank you so much for that. I want to kick it over to Brian. As an executive director of a pharmacy state organization, you get to see and hear so many things that end up trickling down to the impact of PBM reform at the state level, but then also at the national level, because you have access to so much of what's going on. Give us some background on yourself, Brian, so that the listeners know who you are and what your focus is around PBM reform.
So I've been with the Oregon State Pharmacy Association as the executive director for the past 4 years. And like Rob, prior to being in this industry, I had never heard of a PBM before either. My dad was a pharmacist at a hospital in the small town in Corvallis. And while we sat around the dinner table, it's not like we ever talked about PBMs before. So I came into this job, my background's in fundraising and business development, along with sponsorship securement. I had a lot of learning to do. Number one was learn about what PBM stood for and all the other acronyms that go with pharmacy. But there's such a large learning curve that goes with the problems that PBMs are doing. I have a lot of wonderful pharmacists that are on my board that, I think all pharmacists really have that special knack to be able to break things down and explain them to somebody who's not a pharmacist and be able to explain things well so that, somebody who doesn't have a PharmD can understand. And they did that with me for PBMs. And, as things evolve and we get to this point, Michael Murphy at the national level and Michael Baxter at the national level with APhA have done a great job of helping me out with the conversations that they have with Senator Wyden and the other legislators at the federal level and the interactions that we need to have. But at the local level, Rep Nousse has been fantastic to work with and has really been taking the charge. The amount of hours that he's put into just the PBM work group over the past 5 months and what we're setting up for our 2025 legislation has been so helpful. And, it's amazing that he's actually has time to do other things. So, but I'm excited
This
about
is taking a lot of my time though, Brian.
It has taken a lot of your time. And this is only 5 months out of the year. Wait till we get to sessions. So yeah, but it's been great. Plus the previous years and everything. I mean, we're going back 2023 was the first one that we thought we would pass the PBM reform, and had some issues with the Senate Republicans walking out of the legislature for 6 weeks, and that kind of put a huge curveball into our bill that year that's really messed it up on the last day of legislation. We had a vote of 14-11 in the Senate that was in our favor, but that didn't reach the 2/3 majority favor to pass that bill, and so. Those votes led to more pharmacies closing since then, and that's unfortunate. And right now with the process and what we're looking at going into 2025, Rep Nousse is going to solve that.
We got to get some other legislators to come along with us.
I think we'll get some other ones.
Definitely get into that.
Yeah, especially if you're in Southern Oregon and your family member needs a prescription, and the next nearest Walgreens that's open is in the Portland suburbs. That's 4 hours away. That story right there is really telling about what's going on with the pharmacy access problem in Oregon. And just throw out one fun fact if you think it's fun. Oregon has the second worst pharmacy access in the country, right after Alaska. So. That's cool. Insane to think about.
That is insane. From that perspective, Rob, talk to the listeners. Let them know what's going on specifically in Oregon right now with regards to PBM legislation.
So Brian sort of alluded to the fact that we struggled to pass a bill in the final days of our legislative session, House Bill 3013. The Oregon legislature meets annually. We meet for a long session in the odd numbered year from like January to the end of June. And in the even numbered year, we meet for the month of February and 1 week in March. And we sort of picked up the pieces from where we ended in the long session when we sort of crashed at the final day. And we passed House Bill 4149, which basically took the least controversial elements of the bill that died in 2023 and put them in place and passed. And so we're standing up a regulatory regime, is the way I like to say it, where we're going to make the PBMs be licensed by the state of Oregon. And what licensure really gets us is if the PBM is engaging in a bad business practice, okay, now it's not just a matter of telling on them, okay, and hoping somebody does something. It empowers our insurance commissioner and the regulatory system within the Department of Insurance to do something about the bad business practice. So that's the main thing that we were able to pass. There were some other regulatory reforms that we got around audits, but I think that's the main thing. Brian alluded to what's coming in the 2025 session. So we just got done with the elections. Let's not go into that right now. The short of it for the state of Oregon and our legislature is I think we show up with a legislature that is prepared to deal with pharmacy challenges and PBM regulation. The trick is going to be, can we pass a bill that makes sure that a pharmacist, when he or she goes to purchase a drug and fill a prescription, can get the cost of getting that drug purchased and filled covered? And then can they get some proper reimbursement for the work that they're doing so that they can pay their salary, cover the cost of their building and their utilities, and pay for the staff and the other people that work around them serving the customers? And so I think that's going to be the hard thing. And I'm happy to talk a little bit about why that's going to be like why getting a pharmacist properly paid with a dispensing fee that helps cover the cost is going to be difficult.
And Rep Nousse, I want to put a quick pin in something really important that you just said relating to just the requirement that PBMs have to be licensed within the state. And I think that's a perfect example just to showcase where states are having to start from when it comes to these policies. And the fact that healthcare providers, pharmacists, healthcare organizations that are providing patient care have to be licensed in a state, but the organizations that determine how expensive a medication is and what the patient's going to pay for oftentimes don't have to be. So it's just been incredible to see the work that's happening in Oregon, and really looking forward to the work that you and Brian are going to do in 2025 to get those additional provisions passed.
So, Michael, your listeners might, if they nerd out on this topic, in 2015 or 2017, I think it was one of those years, we passed a thing where the PBM had to at least be registered, which basically means like, hey, if you're doing business here in the state of Oregon, you have to tell us. That's how secretive this industry was in our state. These are very large, major corporations, 6 in the United States, that dominate between 80 or 90% of the business, depending on where you go on the internet to get your information, okay? And nobody really knew about them. Now, thankfully, because of the activism of pharmacists, frankly, because media outlets are covering this, frankly, because Americans experience some of the highest prescription drug costs on the planet, there's been a lot more churn and knowledge and understanding of PBMs. But I still find myself doing a lot of explaining to, especially to new legislators who, many of them, have good health insurance. They don't know anything about the PBM infrastructure that's behind what they're paying for medication or how their insurance plan works.
It's such a complicated process, and it's been the past couple of years. I think that we've definitely seen the curtain pulled back to better understand where the price of medications really is coming from. But Rep Nousse, you said something about how there's been a lot of advocacy within the pharmacy profession around this. Brian, I mean, you all have done such a good job of mobilizing pharmacists. What's that been like in Oregon to get pharmacists to, help to provide education around some of these issues with PBMs and, helping to ensure that, good lawmakers like Rep Nousse understand these issues and how they impact patients.
Brian, I have
I'm,
thoughts about that, but if you want to, you go first, and then I'll share a little bit about Representative Goodwin.
okay, that sounds great. I'm really fortunate to work in a state with such wonderful pharmacists that want to participate. They care about their patients so much, and they care about their businesses. As we were working through this work group this summer, we had so many people that wanted to be involved, and we had to limit it because we couldn't take everybody that wanted to help. So getting pharmacists in Oregon to be active isn't an issue, and they answer the call every time we say that there's an immediate need to reach out to your state legislators. We need these things from you to act quickly, and they want to help because they know that PBM reform is so important to their business and to the patient's well-being. So, you want to add to that, Rob?
The Oregon legislature, I mean, it's dominated by Democrats, okay, but we try to be bipartisan when we can. And one bit of really good luck that I had, I don't know if that's totally luck, I mean, I'm sure folks worked on her and approached her, is my colleague, a Republican, okay, her and her husband run an optometry business. And optometrists get treated badly by some equivalents of PBMs, okay, in their space. And so a local pharmacist reached out to her and educated her about the business practices of PBMs and what they were subjected to. And it made it that I had an ally that was smart, that understood the issues, that was meeting with local people. So she was conversant about PBM business practices and pharmacy businesses practices, and she could talk intelligently about what was happening. All right. And then I had an ally in that human. And so the issue was not partisan. And especially because in Oregon, the bulk of the pharmacy desert situation is in rural areas. This is a very big state. Portland is the only major city. The rest of the cities in the state are pretty small, actually. College towns, okay? Our state capital is only 100,000 people. So it's really like areas of the state that are rural, that are dominated by Republican representatives and Republican senators that need this even more than people in my area of the world. So that was a bit of good fortune that we had.
Yeah, I totally agree. And I think that's been one of the things that has been incredible to see from across the country as I've worked to support the state pharmacy associations and advocating for these bills, is that they truly are bipartisan. And they're being introduced in blue states and red states equivalently. And I think that's really important to see, because regardless of your politics, medication costs are just out of control for Americans. And I think that's what we've consistently seen, is that one of the primary reasons is because of these, egregious PBM practices. And what's been really unfortunate to see is just the increase in closures, pharmacy closures across the country. So I'm sure those rural constituents are really concerned about this issue, Rep Nousse, because if we don't take action, their pharmacies are going to close, and then they've lost access, and they really don't have other choices.
And so it was fascinating. Just a few years ago, we have sort of a local regional chain in this area called Buy Mart. It's a super discount grocery store, okay? And they're doing fine financially, okay? Like they're still very much in existence, but they made a business decision to get out of the prescription drug business and not dispense prescriptions at their stores anymore because they were losing money on it, all right? To the point where they didn't feel like they could sustain the service. So when a chain grocery store can't figure out how to make money selling medications in community, we know we're in big trouble. So now we also have Rite Aid, which I know some folks have said, well, that company was struggling with their business practices. Okay, I don't know enough about that to go neither here nor there. But then we've lost Rite Aids. And then we've heard recently in the news, Walgreens is also struggling. Yep. So a local chain grocery store with lots of locations in Oregon isn't providing medications anymore. Rite Aid is practically going out of business in this state. Walgreens is going to consolidate, okay? And then we've got ma and pa, local independent pharmacies that are also struggling. We have to get our arms around this and make PBM business practices be something that, sure, it helps keep medication costs down, helps insurance plans, but also has to sustain a network of pharmacies and pharmacists if we're going to provide prescription drugs to our people. Your listeners may not know this, but Oregon is a very big state geographically, and it gets pretty rural really fast. So it's not surprising to me that we're struggling with pharmacy deserts.
One other thing about patient access that we'll have to figure out how it's going to play out is the Kroger-Albertsons merger and what that's going to mean for
That's right.
closures as well. So I mean, that's something that's looming out there as well as we're getting ready for session.
Yeah, and Rep Nousse, you and Brian talking about one key issue really struck me, and that's just the fact that pharmacies are being under reimbursed for their cost and have to either choose to take a loss on a medication or have to, you know, tell that patient, hey, there's another pharmacy you might be able to fill this prescription at. And that what an awful position
It is
for
awful.
a healthcare provider to be put in. And that's consistent. And what's really concerning too is that we're seeing variability in that reimbursement from drug to drug and from pharmacy to pharmacy. I know that the Mississippi Board of Pharmacy actually just released an audit where they were looking at PBMs that were reimbursing medications to pharmacies that are affiliated vertically with the PBM and non-affiliated pharmacies, and actually found that the pharmacies that are affiliated with PBMs are being reimbursed far higher. So we're just seeing a lot of these practices that are putting the sustainability of community pharmacy at huge risk.
Michael, that's a really nice segue. So the bill that Brian and I worked on in the work group that we had this summer. So for your listeners, legislation does not just show up in any legislative body, probably anywhere in the United States. There's a lot of work that leads up sort of behind the scenes or before you actually start legislating to figure out what's the best policy, what do we need to do, what research, what have other states done? I mean, Oregon is definitely looking to copy what's been successful in some of the other states in the country. And we're for sure going to be tackling one of the topics you just raised, which is how come the CVS PBM reimburses its own pharmacies much better than the local independent one that's operating in a community just 20 or 30 minutes away.
Yeah, it's crazy to think that we're trying to put together a bill that's just going to get the cost of the drug covered. We're just trying to break even.
And I think, so Democrats by stereotype don't necessarily come off as like small business advocates, though I'm lucky that I've got several different Democrats that are running small businesses. But by stereotype, Republicans tend to be a little bit more business minded or have business, small business in their background. And it's a pretty easy soundbite for a politician to make, saying, imagine going to provide a product to somebody, and every attempt that you make to do it, you always have to provide that product at a loss. How do you stay in business when you do that? And it's just a pretty, it's an intuitive soundbite that just about everybody can understand. Like, that's just not sustainable.
It's caused the profession to be forced into a corner of commodity, which is not what pharmacists are about. Pharmacists are those medication experts that are doing so much more than what the public realizes. And I'd like to see us move away from the dispensing fee to a fee of service that it's really about the therapy. And an example is if a pharmacist to save the life or to curb the medications of a patient taking 4, 5, 8 medications prescribed by their physicians. And if they decided, based on their knowledge of the pharmacological mix-up and drug-drug interactions, that one of those medications isn't good for you anymore, gives the message to the physician says, hey, thanks for flagging that. You pull that medication, the pharmacist doesn't get anything. And they just did their job. Yeah, they just kept you alive, and they made $0 doing it. And it's just like, what's going on?
I don't know if you want to go down the rabbit hole. Part of the challenge, I would say, of fixing the PBM business model and helping pharmacists be making it more viable for them to stay in business is that the American healthcare system is not really a proper system like it is everywhere else in the world, right? So you get health insurance one way in Oregon if you're poor, okay? That's Medicaid, right? We call it the Oregon Health Plan here, okay? You get it another way if you're old, okay? Medicare, okay? If you're employed and you work for a big company or one that's doing pretty well financially, you're probably on an ERISA-based plan, and we could go down the ERISA rabbit hole if folks want to do that here and nerd out about that topic. But ERISA plans are not regulated by any state. They're federally regulated, okay, which makes it very difficult for state lawmakers to interact with and fix bad business practices that ERISA plans engage in. And then, oh, by the way, state government workers and university employees, which are part of the state government system, we also stand up a health insurance benefit, and we regulate, pass laws ourselves around our own insurance benefit. So you have 5 different systems.
Jeez.
And if I fix a problem in the Medicaid space, I don't necessarily always fix the problem for a Department of Consumer Business Services regulated plan or a state of Oregon insurance plan. I've got to think about all of those things when I'm trying to pass bills. And sometimes, like with Medicare, the fix is only federal.
Exactly, Rep Nousse. And I think what's been great to see is that the state lawmakers across the country are stepping up to address harmful PBM practices that they can within their states. And that's the exact reason that we also need to see Congress step up and act to address this federally so we can see reform within the Medicare program and for ERISA plans. That's the exact reason that APhA started the End Harmful Practices of PBMs Now campaign to really push for and to advocate to members of Congress to take action on some of these federal legislative priorities. Yeah. And Brian, you've been such an incredible partner. All of the meetings that we've had with Senator Wyden's team, I think have really helped to move the needle and showcasing why Congress needs to follow the great work that we're seeing in the states and finally pass PBM reform.
It would be super helpful if the federal government could sort of address some of these business practices across the United States, and with like ERISA plans and and Medicare, like it would help tremendously because so many Oregonians, they're getting their health and care through Medicare, or they work for a large enough employer that they're on an ERISA-based plan that's regulated federally, not locally.
Yeah, and Senator Wyden's been such a great advocate for pharmacy. It's been really great to have him in his position with the Senate Finance Committee as chairman, be the representative, obviously from Oregon. Yeah. So, I think that I've heard of, I know a lot of pharmacists and legislators who have had relationships with him, but Michelle Belcher, who's the owners of Grants Pass Pharmacy and past NCPA president, had gone out to Washington, D.C. one time to meet with him, and he wasn't available. But on the flight from D.C. back to Oregon, she just happened to be seated right next to him and had a 4-hour conversation with him to talk about PBMs. So that's how they developed their relationship. And now every time that he's in Southern Oregon, he stops by her pharmacy to have a Coke float and talk about PBM reform. So it's a great relationship.
So Michael and Todd, for your listeners, you probably don't know this. There's only 4 million Oregonians. We're actually not that very big of a state. And it's pretty easy to get to your politicians. It's a little more work to get to a United States Senator, I'll confess that. But most of my coworkers in the Oregon legislature, really all of them, actually care about representing their constituents, trying to do a good job, trying to understand issues, all right? It's pretty easy to get to your politicians in this state to try to ask them to address challenges.
That's awesome to hear.
That's a great story, though, about sitting next to the United States Senator for 4 hours and bending his ear about PBMs. And Senator Wyden's pretty smart, actually. He likes to nerd out on stuff, so good for her.
Michael, let's see if you can share, because you brought up something that's piqued my interest, and I know the listeners are wondering. share an update of the current status of the End Harmful Practices of PBMs and what listeners can do to help out in spreading that word and that news, and anything else that you can share about that.
Yeah, of course. Well, I think ideally everyone would have the opportunity to sit next to their U.S. senator for 4 hours and talk about these issues. But if that's not the case, APhA has different resources available so that pharmacists can send letters and examples to their senators and members of the U.S. House of Representatives, asking for them to take action on some of the different PBM related bills that are currently being considered. There's numerous bills that have been introduced in Congress. A couple of them that APhA is watching closely because they have passed out of either a chamber or if they made significant progress in committees are the Modernizing and Ensuring PBM Accountability, or MEPA Act, the Better Mental Health Care, Lower Cost Drugs and Extenders Act, and the Pharmacy Benefit Manager Transparency Act. We're watching all of those bills really closely, especially now that the election's over and we're in this interesting lame duck session of the Congress until the end of the year, because we expect that there's likely going to be some potential packages that are put together, potentially around continuing to fund the federal government, which the current expiration of that will occur in December. And we're really trying to get our members activated to reach out to their members of Congress to encourage them to include PBM reform measures in that end of year package. If we don't get this done this year, the Congress will end and we have to reintroduce these bills, and we really have to start the process from the beginning. So now is really go time in activating folks as much as possible. So pharmacists, if possible, talk to your patients about these issues, because while this is an issue that impacts pharmacists, it's really an issue that impacts patients and how they can access their medications and is causing the closure of pharmacies across the country. So as much outreach as possible is needed in the coming weeks.
And Todd, if I could just interject. So in Oregon, we start our session in 2025. We're going to have a bill. We don't have a bill number yet, but it's going to take on a bunch of different things that we either didn't get accomplished in the bill that failed or didn't get accomplished in the bill that we passed in our. So we're going to continue to work on making sure that PBMs have good business practices. We're going to prohibit any sort of punitive audits or other kinds of retaliation that PBMs might engage in when a pharmacist sort of sticks up for their rights or insists on being fairly compensated for a drug. We're going to do some things around access so that you can't, if you're CVS or Express Scripts, prioritize the pharmacist that you like or that you're vertically integrated with to something else. But the big things are we going to make it so that when the pharmacist goes to get the drug, their cost of purchasing that drug are covered? So we're calling that, we want to move to NADAC pricing, which I'm sure your listeners know what that is. And then we want to have a reasonable dispensing fee that's provided for. And the reason why that is important is because the pharmacist deserves to be reimbursed when they go to fill a prescription. But candidly, that will mean that the cost of the medication potentially at the counter when the patient goes to fill it, depending on the kind of insurance plan they have, is going to go up. So that's going to be the challenge that we'll have. And I'm glad the bill is bipartisan so that one party or the other can't say Republicans just want to raise the cost of prescription drugs or Democrats just want to raise the cost of prescription drugs. Okay, we'll be able to avoid that sort of debate. But the question is going to be, can we say, look, yes, sometimes the cost of a medication, depending on your insurance plan, is going to go up. But if you want to have pharmacists, they deserve to be paid, and we've got to be able to compensate them for the services they're providing if you're going to have something here in your community. So that's going to be the way we're going to try to go through the front door and say, look, embrace the policy. Don't be scared by occasionally somebody, when they go to get a drug, might have to pay a little bit more to have a provider there.
It's been great.
It's landed in other states. Other states have passed dispensing fees for pharmacists, red states and blue states. So that gives me some hope.
Absolutely. And it's such a wild concept to be paid for at a fair and reasonable fee for the service that you're providing. What a crazy concept that one is. But we're seeing those types of policies passed all over the country just to make sure that the pharmacies are able to maintain their costs and operate sustainably. And
Right.
Brian, I'm sure a lot of your members right now are going through and having difficult discussions around continuing to operate their businesses. And these policies that we're talking about, both at the federal and state level, they need to pass as quickly as possible to make sure that the pharmacies don't continue to have to shutter their doors.
Yeah, I mean, it hurts every time there's a pharmacy that closes. It doesn't matter if it's a independent
That's right.
pharmacy, a chain pharmacy, a grocery pharmacy. It's painful for us. And although we're the Association for Pharmacists and Pharmacies in Oregon, we've become more of a patient advocacy group because we're so concerned about making sure that everybody
Right.
has access to their medications. And it's a terrible position for a pharmacist, especially an owner, to have to decide, am I going to reduce my hours? Am I going to have to cut a technician or a pharmacist if it gets to be really bad? What am I going to do to stay in business, and how am I going to be able to operate? Because, there's got to be, at this point, they are doing some significant cuts in order to make sure that they can stay open, and we thank them for doing that, but that's obviously at the cost of the patients. And you can't have pharmacies closed and not have access to the drugs, and then have the patient go to the emergency department at the hospital. Like, that's just going to clog up the system even worse, and it's going to be way more expensive than it is just to provide the cost of a drug and a dispensing fee. So, and nothing that we're doing is like earth shattering in Oregon. Like, we've taken the best practices from other states and are utilizing them into one bill. We're not going, overboard and that kind of thing. We're just trying to keep it pharmacies in business.
Yep. Access. Like, that's the name of the game right now, with 7,000, 8,000 less pharmacies today than what were around 3 and 4 years ago. And our population is not standing still. It's growing. So we're going to need more pharmacists and more interaction. Michael, I'm looking forward to seeing you for the APhA 2025. Let's make sure that we get you on the APHA's Locked on Pharmacy post show. And Brian, if you're going to that event, I'd like to tie you in as well in order for us to extend these kinds of conversations and really tagging into your pharmacist membership. Representative Nousse, just like dose, you have been a dose of light for us today in your words and your support of PBM reform, and you understanding, and this is the key, you understand the domino effect and impact of your constituents and the people that you serve, and you understand how this prevents them from being healthy and living their best lives, and that is the most important thing. So I want to thank you so much for spending time with us on the APhA.
It's been my pleasure to work on this, actually.
Thank you.
Yep.
Hey, thank you for listening to another episode of Locked on Pharmacy. We want to thank our guests. We want to thank our pharmacists out there working in the trenches, our pharmacy technicians, people supporting our pharmacy profession. We're getting ready for APhA 2025 in Nashville, March 21st through 24th. Ignite your inspiration in Nashville. Igniting inspiration is the theme. We are so excited about 2025 and what's coming for our pharmacy profession. Registration is now open. Take a look at the aphameeting.pharmacist.com. Once again, that's aphameeting.pharmacist.com. Be sure to subscribe to Locked on Pharmacy on your favorite podcast platform. And we thank you for listening. to Locked On Pharmacy.